asleep amidst the trees.
Depression is a widespread epidemic, and society is not helping in any way. With up to 36,909 people dying as a result of depression, the World Health Organization has catalogued it as an epidemic. Sometimes depression is confused with a passenger state of sadness, of nostalgia, of not wanting it, and the teenager has very peculiar characteristics. We will not see him normally isolated, totally crying in a corner as we apparently consider depression as a disease. With that we see him very irritable, very anxious, very challenging, very questionable, questioning his letters at this time, his parents for example.
Nowadays, depression's prevalence has risen due to a lot of different factors. One of those first factors is that population has a lot more information about it, and subsequently, people who suffer from it and their acquaintances identify it with more ease. They identified that they can have depression and that it is a problem that has to be treated, and that it is not a normal situation of one person's life. This bigger quantity of information also contributes to an increase in the capacity of detection from professionals and specialists, more so in the case of a family's doctor, who is the person who can recognize better the depression in patients that go to their consult with determined symptoms, which was really more difficult 30 or 40 years ago. Fortunately, the stigma that going to the psychiatrist had, or that you were being treated for a mental problem or for depression, has diminished a lot. Thanks to this, patients that suffer from depression are more disposed to ask for help. Another factor that also has an influence in the sensation of bigger prevalence is that the assistential network has risen or has augmented, and therefore there is much or more and there is a bigger capacity of detecting and treating these cases. Family doctors can perfectly treat the most part or a bigger part of cases of depression. In fact, the tendency has been to give worse or different cases to specialists that have certain particularities. For example, those that can be considered worse due to the patient presents certain symptoms like suicidal tendencies or psychotic symptoms that can worsen the depressive case. The biggest part of low tier or low to mid tier depression cases and then don't have any other complications are nowadays managed by the primary attention level.